Well, hello, good day, everyone. It's Dr. Scott Stoll, and I have the pleasure today of speaking with Dr. Dean Ornish, father of lifestyle medicine, amazing father, husband, innovator, researcher, and transformer around the world. Dean, welcome. It's so good to have you. I appreciate your friendship, and I want to thank you for taking time to be with us today.
Well, thank you, Scott. I love you and appreciate you and your leadership and your vision and the opportunity to be of service in such a meaningful way, but mostly just to have the chance to catch up with each other.
Yeah, I agree, Dean. Thank you. And as we were saying just before we started, it's wonderful to see each other, and we're so grateful for technology that allows us to connect and see eyes and see smiles and at least feel warmth across the technology. But we do look forward to being together, sharing a good meal, and as we said, a good hug to say hello. So that's forthcoming.
Indeed.
So, Dean, as we were just at the beginning, you mentioned some things that I think are really important for people today. And in the genre of technology, you were just sharing with me how technology is allowing you to deliver your programs more effectively. And I think for all of us that are in healthcare, that are taking care of patients, and because of COVID, we've been pushed into technology. And in some ways, technology can be frustrating and challenging, but in other ways, it's opened up new opportunities for us to reach new groups of people with information that's invaluable that they may not have had access to. And I know that you're doing this with your programs, and if you would just maybe take a few minutes and share with everyone the positive benefits of these transitions that we've seen and how it's impacting patients and changed your program.
Sure. Well, I appreciate that. And for those who aren't as familiar with my work, for the last 43 years, I've directed clinical trials and demonstration projects showing that simple lifestyle changes, a whole foods plant-based diet that's low in fat and sugar, moderate exercise like walking and some strength training, meditation and other yoga-based stress management techniques, and psychosocial support, eat well, move more, stress less, and love more, can not only help prevent but reverse the progression of the most common chronic diseases: coronary heart disease, type 2 diabetes, early stage prostate cancer, hypertension, hypercholesterolemia, and perhaps even early stage Alzheimer's disease. We also found these can lengthen telomeres, change gene expression, and so on. And the more diseases we study, the more evidence we have to show that. And we'll talk a little bit later about this unifying theory of why these same lifestyle changes affect so many different disease states. About 10 or 11 years ago, after 16 years of review, CMS agreed to provide Medicare coverage for my reversing heart disease program in a new disease category, new benefit category called intensive cardiac rehabilitation. And since then, we've been training hospitals and clinics throughout the country. And it's worked. We're getting bigger changes in lifestyle, better clinical outcomes, bigger cost savings, better adherence than anyone's ever shown. But you have to live within an hour drive time of one of the hospitals or clinics or physician groups that we've trained. And most of the country, is still out there. And so I've resisted the push to virtualize the program because I really thought it's such a high touch program that it just wouldn't work as well when done over Zoom or anything else. But I learned that I was wrong, actually. One of those times I was glad to be wrong, because about 2 years ago, we began the first randomized controlled trial to see whether these lifestyle changes may stop or reverse the progression of men and women who have early stage Alzheimer's disease. I think we're at a place with Alzheimer's very reminiscent of where we were back in 1977, 78, when I started doing research on heart disease. And we can talk more about that, but the short version is that back then it was thought that heart disease couldn't be reversed. At best, you could slow it down. We showed that if you made bigger changes in lifestyle, you can not only stop it, but even reverse it. Ounce of prevention, pound of cure, if you will. And I think we're at a similar place with Alzheimer's, which shares the same underlying biological mechanisms. Less intensive lifestyle changes can help slow the rate of getting worse, of getting dementia. Our hypothesis is that more intensive ones may stop or reverse it. And if it turns out to be true, and it's still a big if because we're in the middle of the study, in many ways, that'll be even more important than the earlier work, because at least with heart disease and other conditions, there's some drugs or interventions that have some benefit. But with Alzheimer's, they've spent billions and billions of dollars, and at best you can slow down the rate at which you get worse, and that's about it. And the only new drug that's been approved in the last 18 years was aducanumab, over the objection of 3 of the FDA commissioners who resigned in protest, because it it barely slows the rate of getting worse. And a third of the people have brain hemorrhages or brain edema, and it costs $56,000 per year and doesn't do that much, but it just shows how desperate people are for some hope. So in any event, we're meeting with the patients with Medicare and the cardiac program. It's twice a week, 4 hours at a time for 9 weeks. They get an hour of supervised exercise, an hour of stress management, an hour of a support group, and an hour of a group meal with a lecture. With the Alzheimer's patients, it's the same intervention, but we were doing it 3 times a week, 4 hours at a time, just because we want to give them the support. We also even provide them 21 meals a week for them and their caregiver. Now, we had to virtualize that back a year and a half ago when COVID hit, because this is one of the most vulnerable populations. And it was either that or shut the study down. So I figured, okay, let's just see what happens. And to my great delight and surprise, it's worked much better than I would have ever imagined. It's, these are people who've never even met each other in person, who even our support groups are sharing the most intimate and authentic and open and loving ways with each other. It's such an isolating experience to be diagnosed with Alzheimer's anyway. I thought, wow, this is really amazing. It's very cool. And of course, as Frank Sinatra used to sing, if I can make it with Alzheimer's patients, I can make it with anyone. And so we're realizing now this will work with cardiac patients as well. And so instead of having to live within an hour driving radius of one of the sites we train, you can live anywhere in the country, and we can do it virtually. And we can reach people in rural areas that otherwise wouldn't have access to this. So the other breakthrough is that last October, almost a year ago, CMS agreed to provide Medicare coverage for my reversing heart disease program when offered virtually at the same rate as when it's done in the bricks and mortar world. So that was a real game changer in terms of making it financially viable for lifestyle medicine practitioners to do this. And Aetna is now also providing it, covering it when provided virtually in all 50 states. And we're hoping others will follow their lead. And it looks like that in either the infrastructure bill or one of the bills that's going through Congress now, they're going to extend the virtual coverage for at least another year or two while they're trying to determine if this is saving money or costing money. But it's, patients in some ways often even prefer the virtual coverage because they don't have to get in a car and drive anywhere. A lot of people don't want to go to a hospital or park or, all the things related to that. You just go in your living room, just like we're doing now, put on Zoom, and boom, there it is. So it's really changed my thinking about that. And ultimately, I think it's going to make lifestyle medicine that much more accessible and affordable to the people who most need it.
Yeah, that's exactly right. And I think you're going to be sharing some of this, right, in your lecture for the PBNHC. The science behind your program, both cardiovascular and Alzheimer's, right? And so we're delighted to have you as a part of that. And I know that the science behind the reversing Alzheimer's is really new and cutting edge. Maybe we can just take a minute and you can just give us a window into how lifestyle medicine can tackle this problem.
Well, I think, in the book that my wife and I wrote called Undo It, which is going to come out in paperback in January, we put forth this, what I thought was a radical unifying theory that's been incredibly well embraced, writing it up for JAMA now, that I was trained like you were and most doctors to view heart disease, type 2 diabetes, prostate cancer, perhaps Alzheimer's as being fundamentally different diseases, different diagnoses, and different treatments. But over the last 4 decades, we found with all this interest in personalized medicine and so on, that it was the same lifestyle changes we talked about earlier that could stop or reverse the progression of all these wide-ranging different conditions. I thought, well, why is that? And then it just kind of hit me in kind of a blinding flash of the obvious that maybe these diseases aren't really so different, that they have more in common than they have different, because they all share the same underlying biological mechanisms: chronic inflammation, oxidative stress, changes in immune function, in telomeres and angiogenesis and gene expression and the microbiome and so on. And each one of these mechanisms in turn is directly influenced by what we eat, how we respond to stress, how much exercise we get, and how much love and support we have. And so viewed from that lens, it also helps to explain why you find what are called comorbidities. The same patient will often have multiple chronic conditions. They'll often have heart disease and type 2 diabetes and be overweight and have high blood pressure, high cholesterol, and so on, because again, it's just the same condition manifesting in different forms. Or in other parts of the world, like Colin Campbell showed in the China study, when people were eating fairly healthy and exercising and so on, they had very low rates of these diseases, all of these diseases, and yet when they start to eat like us and live like us, then they start to die like us, and they develop, all these conditions as well. So, I thought, okay, well, we're at a place with Alzheimer's that's so reminiscent of where we were in 1977 when I began doing research on heart disease, that the less intensive interventions we mentioned a moment ago slow the rate of getting worse, the ounce of prevention, if you will. Maybe a more intensive intervention might stop or reverse it. It's hard to reverse chronic diseases. The reason we showed it before anyone else in randomized trials is that most people didn't go far enough. It's really, you have to make really big changes. You don't have to make such big changes to prevent disease, but you do to reverse it. And so the finger study, which is a Finnish study, which is now being replicated as the pointer study here, the MIND and MEN studies and others like that, have shown that less intensive lifestyle changes, like a Mediterranean diet, for example, may slow the rate at which your Alzheimer's gets worse. We thought a more intensive might actually stop or reverse it. So we're doing a randomized trial of 100 men and women who have early Alzheimer's. And now that we're doing it virtually, we're now collaborating with the heads of neurology at Harvard Medical School and the Mass General Hospital and the Brigham and Women's Hospital, the Cleveland Clinic, University of California, San Diego, and probably a couple of others as we move forward, which will enable us. They'll do the tests and recruit the patients locally, but we'll do the intervention from here with our team. And we could just beam in. It could occur to me whether the patients live in the Bay Area, or they live anywhere. It doesn't really matter if you're doing it by Zoom, you could be anywhere. So that'll hopefully enable us to finish recruiting the patients more quickly, as well as to add the additional credibility of having such world-renowned investigators collaborating with us. And I have, my mom died of Alzheimer's. All of my aunts and uncles did. I've got one of the genes for it. So I have a personal interest in this. And Alzheimer's is like the worst disease because it takes away all of your hope. The doctor usually said, I'm sorry, there's nothing we can do. At best, we can slow it down a little bit. Keep them at home. Don't let them go out. Don't let them wander off. And by the way, we're going to take away your driver's license. So your world keeps shrinking. And that isolation itself and that sense of despair that comes when you take away hope is incredibly self-fulfilling in a negative way. People just start to go to this downward spiral. And to me, one of the reasons why I've spent so much of my adult life doing research is that properly done, with the right experimental design, randomized trials, published in the leading peer-reviewed journals with the leading investigators, it can often redefine what's possible, like we did with heart disease, for example. And so then you give people hope, millions of people at this point, new hope, new choices, which itself can be self-fulfilling, but in a healing way. So you start to go, wow, well, okay, this is kind of like, okay, diet and kind of weird, and exercise, but meditation, that's really weird, and love more, are you kidding me? But okay, it's been published in the journal of the AMA or the Lancet or JAMA, or New England Journal, or whatever. Let me give this weird stuff a try. And because these biological mechanisms are so dynamic, in both directions, you can get better quickly or worse quickly. In the case of heart disease, if you make these changes, your chest pain or angina often goes away in the first few weeks. And then you start to go, oh, okay, I get it. It's not just about fear of dying and preventing something really bad from happening years down the road, the heart attack that doesn't come. But wow, in just a few weeks, my angina, my chest pain's gone. I can play with my kids. I can make love with my wife. Or husband. I can, go back to work. I can walk across the street without getting chest pain, whatever. So it reframes it from fear of something bad happening years down the road to what I gain now or very quickly is more than offsetting what I'm giving up. Like patients say things like, I like eating junk food, but not that much because I like not having chest pain even more. The Game Changers film that James Cameron did, which I think was so brilliant, and Luis Hoyos, showed again how just a single meal can make a difference in everything from athletic performance to sexual function to whatever. So it just really changes that whole framework to emphasize how these short-term gains, which are really what makes it sustainable. If it's pleasurable and if it's meaningful, then it's sustainable. And now we can do that by remotely without just having to do it in person. So it's a whole new world.
Yeah, it really is a whole new world. And hope is a very powerful emotion, isn't it? The science around hope is that it actually activates the frontal lobes that are involved in long-term planning and strategic ideas. And there's molecular machinery that's put in place that allows people to actually begin seeing a new future. And so that's why this work is so important.
Well, that's true. And and as I say, it's such an isolating disease that people get so despairing when they have all their hope taken away. Then it becomes self-fulfilling. It's like the mind shuts down as an adaptive response to just such bleak, horrible feeling like there's no hope there. It's like that scene in 2001 where they start to take the memory chips out of Hal the computer and he starts to sing, Daisy, Daisy. It's like you just feel like you're just going down this downward spiral of never, it's like people say things like I felt like I wasn't me anymore, And then if they start to get better, then they start to talk about how this is, redefining their, like I'm back, my sense of self is back, my sense of self-worth is back. I can, to the extent that if they get better. So I don't want to talk too much about the study because we're still in the middle of it, but I'm cautiously optimistic. Whatever we show, it'll be important. If we show it does nothing, people need to know that. But if we show that we can actually slow or stop or even reverse it, especially since there are no drugs that can even stop its progression, much less show improvement, then that we're hoping at least, and it's still just a hope, that we can redefine what's possible for people, and that can be self-fulfilling in a healing way.
No, and I know you're being cautiously optimistic, but this work is so important. I was just in a meeting on Monday with a friend of mine who's 84, very bright gentleman who's an investor, and he was diagnosed with early dementia, early Alzheimer's about 2 or 3 years ago. And he decided not to allow that to be his future, his destiny, and decided that he was going to start working every week to reverse his Alzheimer's. And so he met with our friend Dean Ornish and developed a program. And over the last 3 years has been exceptionally diligent. And just last week, he took a new cognitive test and scored 100.
Wow.
And he was in tears. He was in tears. He said, my life has changed, my future has changed, my marriage has changed because of this lifestyle information. And so, I know the work you're doing is so important because I saw the tears on his face. And that if this work proves out in the research, it's transformational for millions of people around the world.
Yeah, well, Dean Ornish and his wife are doing. Anybody named Dean has to be a cool guy, first of all. But
yeah,
but it's everything that we've done over the last 44 years, my colleagues and I, people thought was impossible, just like they think it's impossible with Alzheimer's today. And I love doing this work, because again, properly done, research can often redefine what's possible and give millions of people new hope and new choices in areas that are the most meaningful for them. So like, what could be better than that? That's why I think for those of you watching this who are interested in lifestyle medicine, I'm still as passionate, if not more passionate now, 44 years after starting this work than I was when I began, because, what can be better than working with people and empowering them with information that can transform their lives, not only in terms of reversing their biological illness, but often they say things like, having a heart attack was the best thing that ever happened to me. The first time I heard that, I said, what are you, nuts? And they say, no, that's what it took to get my attention, that it's made my life so much more joyful and meaningful. I'm quieting down my mind and body and rediscovering inner sources of peace and joy and love and meaning that I didn't really know before. I'm spending more time with my friends and family because I realize how important that is. I'm feeling better in other ways. And it's important to me that I know that what's good for me is good for the planet. So what I'm doing that's helping me is going to reduce global warming and feed the hungry and reduce deforestation in the Amazon and reduce, billions of animals suffering who don't need to be, and so on. And so, you and I were trained to view suffering as something to be numbed or killed or bypassed as soon as possible. But to me, suffering is a opportunity. Not that we look for it, but there it is sometimes, And we have this sacred opportunity as physicians to be more than technicians, to be healers in the sense of working with people when they're the most vulnerable, they're most suffering and the most fragile, and say, look, not to blame, but to empower. There's a lot you can do to change this. Change is hard, but if you're hurting enough, then the idea of change becomes more appealing. It's kind of like, well, it's kind of weird, and gosh, I don't know if I can do this, but boy, I'm hurting so badly. Let me give this weird stuff a try, especially because research has shown that it works for a lot of people. And then when they start to do it again, because these biological mechanisms are so dynamic, then it comes out of their own experience and it takes it out of the realm of, well, maybe it is, or maybe it isn't, or yes, no, or maybe so, or whatever. But like, oh, I know from my own experience, when I do this, I feel good. When I do that, I feel bad. So let me do more of this and less of that. And that's ultimately what makes it transformative and sustainable. And that's what I'm always interested in, what I call the conspiracy of love, is to help people when they're suffering, to see that, not that we look for suffering, but sometimes there it is, but to see that in the context of, oh, this is my inner teacher telling me, okay, now I can use this as a catalyst for transforming my life in ways that not only help me live longer, but help me live better as well.
Yeah, that is so beautiful, Dean. And I think that's the essence for so many of us in this space, especially leaders like you, that, we're compelled by love to do what we're doing because we care about the person sitting across from us in an exam room. Or for you, it's your research, the deep work that you've done in your research projects is driven by, these small groups that you can see multiplied across populations and lives and families transformed. And I know that so much of your work and all of the time and effort and personal sacrifices that you put into this really come from a place of compassion. And we all see that this is truly a life's work for you, and we're so grateful for the life's work that you've put in and all the sacrifices that you've made to elevate lifestyle medicine to a place where so many people are able to step in and practice medicine in a meaningful way, both for their patients and themselves.
Well, thank you for saying that. And, the fact that it's hard is part of what makes it meaningful. I love the speech that John F. Kennedy gave when he talked about we're going to the moon, not because it's easy, but because it's hard, or my teacher, Swami Satchidananda, used to say, they build temples on hills with lots of steps, so you have to work to get up there, or if you ask people, like, what was the hardest thing you ever did in your life? They'll often say, being a parent. And I'll say, was it worth it? And they go, oh, of course it was, just the fact that something's hard doesn't mean that we shouldn't do it. So often doctors think, oh, my patients can never do this, it's too hard. But if you approach the patient and say, just the act of choosing not to do something, not to eat certain foods or be in a monogamous relationship or whatever it is that the ball and chain? Is that deprivation? Well, it can be. Or is it an opportunity to imbue my choices with meaning? And then if they're meaningful, then they're sustainable. And that what I gain is so much more than what I give up, then that also makes it sustainable. So I think the language that we use is really important. And the paradox we're finding is that sometimes it's actually easier to motivate people to make big changes than small ones. Most doctors say, well, I can barely get my patients to take their statin drugs for their cholesterol. A third of statin prescriptions never get filled. Half to 2/3 of people who are prescribed them stop taking them after just 4 to 6 months, even though they are a proven benefit in people with heart disease. And it's just taking a pill once a day. It's like, well, why? If they can't do that, how are they going to make these big lifestyle changes, right? And the answer is because the pill doesn't make you feel better, but the lifestyle changes do. And when you make really big changes, to the degree you make those changes, you feel so much better so quickly. Again, it reframes it from fear of dying to joy of living, that, okay, yeah, it's hard, but boy, what I gain is so much more, just like being a parent. Is it hard? You've got kids. Was that the hardest thing that you've ever done? I would imagine so. What would you say about that?
Yeah, no, absolutely. We have 6, and our youngest is 10, our oldest is 23, and it's the greatest joy and the greatest amount of work and one of the most challenging things I've ever done in my life, but I wouldn't trade it for anything in the world.
Exactly. And most patients, most people would say the same thing. I jump in front of a train to protect my kid, if it was a choice between me or them. And so as a lifestyle medicine practitioner, those of you who are watching this or thinking about doing it, don't be dissuaded by the fact that, you're told that it's hard to get patients to change or it's hard for them to change. That's part of the fun, really, because we now know, we have data now from well over 15,000 people who've gone through our program. 94% of them finished the 72-hour program that Medicare and other insurance companies were paying for after 9 weeks. And a year later, 85 to 90% of the people are still doing it. So we know that people can do it. We've shown that clearly. Don't kind of reframe the idea that this may be challenging to part of the adventure. It's got all the elements of a great adventure. It's got your known allies, your unknown obstacles, the ones that really keep you up at night. And yet ultimately it's like being a parent. It's the most meaningful thing I've ever done. I learned I could take all the meaning out of life when I was suicidally depressed when I was in college. But I also learned we can imbue our lives with meaning in part by choosing not to do something, as well as things that we choose to do, as well as trying to reframe these as opportunities for transformation rather than just obstacles that make it hard to do.
Wow, Dean, this is such amazing wisdom. I'm hoping that we can encapsulate some of these sound bites and we can give these to up and coming healthcare practitioners. One of the new initiatives that we have at Plant Nutrition Project is something called Plant Nutrition U. where we are taking all of the content that we've ever done, we're packaging it, putting it on a platform, and making it available free to every healthcare profession student in the world.
Incredible.
And what I'm hoping, I'm listening to you, is to take some of the wisdom that you have just shared and use that as a lead on Plantrician U for these healthcare profession students.
I'd love
because
that.
what you've said is really incredible.
Well,
You strike such a, go ahead.
Yeah, you first, I'm sorry.
I was just going to say, you strike such a beautiful balance between data-driven scientist and wise pioneer and sage. And that's something I really appreciate about you, is that you have this ability to integrate those two pieces, because that's the essence of medicine. It's the science and the art.
Well, right back at you, my friend. You just have to pay me double what you're paying me today. That's all. Only thing I ask.
Well, that's easy to do.
Like, times zero is still zero. But
that's right. That is right, Dean. Yeah, no, I'll just make the note too for people that are watching. If you want to learn more from Dean Ornish, please buy his book, Undo It. He wrote this amazing book with his wife. It's a unifying theory of lifestyle medicine. Buy it on Amazon, wherever you buy your books, but do get that book. And if you'd also like to see more of Dean, please join our conference, PBNHC.com, September 24th through 27th. Dean is one of our amazing faculty at the conference, where you'll get more of this information, all of the science of lifestyle medicine and plant-based nutrition, as well as the wisdom that's involved in the implementation of lifestyle medicine.
Thank you so much. The book is coming out in paperback in January. You can pre-order it now. If you go to our website, ornish.com, a lot of this information is there and it's all free. So, but let me just say in closing how, Scott, what you've done and what you've created with Plantrician is truly amazing, that you have people from all over the world attending, in the past in person and now virtually. You're just an amazing educator. And to me, awareness is always the first step in healing, and your ability to raise awareness is just unparalleled. So I feel privileged to know you and grateful for the opportunity to be of service in such a meaningful way. So thank you.
Well, thank you, Dean. Feelings are mutual, and I'm really grateful for your friendship. Sincerely grateful for your time today, and appreciative for you joining us at the conference, and look forward to being in person, sharing a meal, and a good hug in 2022.
Me too. Thank you.
All right. Thanks, my friend. And thanks, everyone, for joining us. Again, if you want more information on the conference, www.pbnhc.com. And again, Dean's book, Undo It, paperback in January, but hardback's available now. And if you'd like more information about his program, where can they find that, Dean?
Just go to ornish.com. Thank you.
Ornish.com. All right. Thanks, everyone. Have a wonderful day. We'll talk to you soon.
Thank you. Bye-bye.